And then as far as for nasal valve collapse, is that something that would potentially get worse with time?
So I would say it's definitely something that probably could get worse with time. It's probably maybe something you didn't have a while ago, and then things happen. You might have had nasal trauma that impacted the nasal valve area, or just general aging. The nasal valves are constructed from cartilages, and as we get older, those cartilages get weaker. So, they're not the same strength as it was in your early 20s or early teens. So, in your 30s and 40s, you might begin to realize that, my nose pinches when I breathe in or I try and run on a treadmill. So just aging in general will lead to worsening the nasal valve structure, and it impacts everybody differently. Some people have stronger intrinsic cartilages, some people have weaker intrinsic cartilages. So everybody kind of, evolves, accordingly, according to their anatomy. But, it's definitely something that can develop over time just by sheer aging in general will make your valves get worse.
Yeah.
Everything kind of droops. Gravity
Yeah.
pulls everything down, even the internal and external nasal valves.
You had mentioned nasal trauma, or perhaps like do you see this in younger patients, like young adults or late teens ever for the kids that may have had nasal trauma?
Yeah, I mean, demographics, the risk factors will change based on demographics, but, one of the most common causes of nasal valve collapse that I see in my practice is for, patients that have had surgery before and the nasal valves weren't appropriately, managed. So, they had a dorsal hump reduction or, some kind of internal procedure and they didn't address the nasal valves. So that's a very common one to see in like people in their 20s and 30s. Older patients in their 40s and 50s, I typically see, that haven't had surgery. They just have general aging and weakening of those cartilages. Also trauma. So people that have dorsal trauma impact the internal nasal valves. I've seen people that have gotten nasal tip trauma where they get dislocation of the nasal tip cartilages and that will cause nasal collapse. And one of the, most important things that I've seen for patients having valve collapse is like athletic people. So people that were athletes in, in their teens and early 20s, they use their noses a lot, whether especially swimmers, they're blowing air against pressure a lot through their mouth and their nose. And what I've come to realize is when they get into the 30s, 40s, and 50s, their just nose has been weakened. The cartilages are super weak. So I get a lot of like very athletic people who are like, oh, I could run all the time. And now every time I get on a treadmill, my nose pinches closed and I can't breathe. And that's a lot of just inherent intrinsic weakening of those cartilages. So that's one of the biggest causes that I see too.
I think it makes sense, like just thinking about those cartilages kind of, bending over time, just like if you, like the more you apply that stress, it just kind of weakens. So if you're someone who's done more of that, then it would maybe present earlier. I think that makes sense in my mind.
Well, that's kind of like the whole point what I was making about the physics. It's like when you breathe in, you're increasing the airflow through the nose and it creates a pressure gradient. So the fast moving air that goes through the nose is the lower pressure, and the more stagnant, slow air on the outside of the nose is higher pressure. So the nose will intrinsically, the air will want to push from the outside of the nose to the inside of the nose. So it creates like this pressure gradient that it weakens over time. It's like air's constantly pushing down on the outside of the nose. And the more you breathe in, the faster the air you move in, the more it pinches over time, and that just weakens it.